Mayor Schewel has decided to crash our Zoom, guys. Can we
Okay.
notice?
Hi, Mayor Schewel.
Mayor Schewel, would you like to hop into the conversation and tell us what one thing has given you hope this week? We'd love to hear from you.
Thank you, Rob. Hey, everybody. How are y'all doing? Everybody hanging?
Good.
Yeah,
Hi, Mayor Schewel.
I know it's not easy. I am really grateful for you all, and just I love what y'all do, city, all organizations there. And I know this is being a really difficult time for you, and I'm excited to hear that you all are talking about the things that are giving you hope. So let me tell you the thing that's giving me hope right now. There is a model that Duke University Hospital does every day. And that model, what it does is it describes, it takes every case that we have in Durham of COVID-19, and then it shows the growth of our cases compared to cases, how they grew on the same day in China, in Washington State, in New York. And it models our future growth against their growth. And what it tries to show is, what will our trend be? When will we peak? And when will we be exhausting the resources of our hospitals, our protective equipment, our ventilators, our ICU beds, all those things. And the thing that gives me hope is that what we're doing is working. We are definitely flattening the curve. You all have heard that. Have you all heard that expression a lot about flattening the curve? Yeah, so that's definitely happening. Our social distancing is working. People are traveling in Durham 40% less than they were 2 weeks ago. So that's a good thing, because people are staying at home, like I am, like you all are. They are really taking this seriously, the stay-at-home order, but just in general, the danger of the virus, and working really hard not to pass it on to others or to get it themselves. And so right now we're doing better than our position on the curve is much better than places like New York, of course, but also much better than Washington State, and much better than the state of North Carolina's curve as a whole. One of the things that affects us is that North Carolina, like Duke Hospital, is a magnet not just for people in Durham, but for people all over the state. So one of our concerns is that even if Durham does very well, Duke Hospital, which is all of our health system in Durham is pretty much Duke Hospital, Duke Health, Lincoln Community Health Center, Duke Regional, and that we have to be concerned that how the whole state does will affect what we're doing. But what gives me hope is how well we're doing, and we have to continue to do that. Yeah, so I'd love to hear any thoughts that you all have, any questions, any observations that you all have as well. And if there's anything that you want to ask me, I'm very happy to hear them.
Yeah, open it up, guys. You guys feel free to jump in. And Steve just wanted to come and really just say thank you to you as our partners for the work that you're doing, and spend a few minutes with us and during our town hall. So hop in. Any questions for Mayor Schewel? Go ahead and fire away.
What's the hospital capacity at right now? How full is it, and how much headroom is there for cases?
I haven't heard in the last couple of days, but the hospital has not been over capacity or even close, because one of the things about Duke Hospital, we are so lucky. I mean, you think about many communities, they don't have what we have. The Duke Hospital has been practicing for this kind of thing a lot. They have regular run-throughs. They are very ready. And one of the things they've been doing is they have been reducing their patient population in anticipation of a surge. So they're not at a high capacity right now. Another thing that they're doing is they have another building that has been planning to come on in about a year, but the first 2 floors of that building they are getting ready now. So our city inspectors are working with them to try to get a lot of things done, approved, so that they can bring on the first 2 floors of that building soon. So again, relative to a lot of communities, we're doing well. If we can stay on the trend that we are now, if we can stay on our current trend line, we'll definitely be able to, at least from Durham's perspective, be able to keep our hospitals from being overwhelmed at the peak. Any other questions or thoughts that you all have to offer? I'd love to hear from any of you. We have there's a lot going on around how we're supporting our homeless residents, around how we're thinking about childcare for children of our emergency and health workers, how we're starting to think now already about how to try to stabilize businesses. So I'm happy to talk about any of that. Or we have a new order coming up, a new amendment to our stay-at-home order. Any of those things that you're interested in, I'm happy to talk about.
I am interested in that, Mayor Schewel. This is Tamika from Hearts. How many cases do we have in Durham thus far? And I would love to hear the update on the stay-at-home order. Any thoughts about how long we're going to be under this order?
Sure. So as of 4 o'clock yesterday, we had 147 cases in Durham. At least as of the day before yesterday, about 70% of those cases were travel related. So where there a lot of them are Duke students, but not all Duke students who traveled, during the early stages. And 95 of those cases have been released from been released. They're either went to the hospital or they're out, or they never had to go to the hospital. And those cases are closed, which is good. It means those people have lived. And, we've had no deaths yet, which is good. When will we be out from under the order? No one really knows this. It depends on us. How well we do the social distancing. Most people think that we will peak in Durham in terms of the number of cases that we have in late April or early May. But the problem is that once you peak, that doesn't end the cases. There's an upward trend till you hit your peak, and then it flattens off, and it takes a while to go down. So I've heard, I've talked to a lot of public health people, epidemiologists, and folks at Duke, and what they're saying is that in the July 4th period might be when we really can come out from under this. Not to say that some of that couldn't happen earlier. It certainly could. Certain things could start up earlier, but that I don't want to be over optimistic about it. I think we're both nationally and here in Durham, we're in for significant disruption, economic disruption of our work through at least the end of June. That's what I know so far. I want to just say, I'm not a pro at this. I'm not an expert. I am taking the advice of experts.
Awesome. Thank you so much.
Thank you, Tamika.
Got time for maybe one more question if you got it. We want to honor Mayor Schewel carved out some time, but we're going to let him go after maybe one more.
When it comes to, go ahead, Julie.
No, go for it. Okay, I was going to ask about everyone's going to be rushing to the CARES Act and trying to figure out how to get some money for small businesses and nonprofits. Is there conversations already about a local response as well?
Yes. Yeah, you're right, Julie. I heard yesterday from some folks at Self-Help that North Carolina, just from the business stabilization fund, the state could get as much as $10 billion. So there's a lot of money in this. And so Durham will get a significant portion of that. And there's a lot of promises from Washington about that rolling out really fast. Now, will that roll out really fast? We don't know that. But in the meantime, we've got to have some bridge financing. for businesses. And a big concern is supporting small businesses that may not normally know how to access this money with technical support to be able to fill out the application and, to be able to have access to federal money. A lot of the money is available, especially some of the smaller forgivable loans, which basically means grants, are available with just a signature. They don't even take, credit reporting and all that kind of stuff. So we need to help do that. And there's a lot of talk already about this. I will say most of my energies, 90% of my energies in the past month have been all about suppressing the virus. But now we're starting to look ahead to how do we help our community, sustain and recover. So I was on a talk today with folks who are working on a local business stabilization fund. Duke University is going to be contributing significantly to it. I believe the city and the county should as well. But our local resources are only going to be a small portion of what's needed. We really are going to need this national funds to hit. And we're going to have to make sure that folks who are running businesses who are undocumented or who are running a very small business and don't have a lot of capacity are going to have the technical expertise to undocumented people won't be able to apply for the federal money, so we need to help them with some local funding, technical assistance. And we need to help other small businesses in town be able to have the expertise to be able to access the federal funds. So we'll be working on that.
Well,
Any more?
you.
I can take one more if Rob.
One more. All right. He gave us a bonus. Anybody got a burning question? Mayor Schewel, get it in now.
Mayor Schewel, this is Joseph Featherstone with the YMCA. Thank you for jumping on the call. You mentioned a little bit ago about our homeless population and those folks and what might be able to help with those individuals. What do you all have? What do we have in place or in plan to be able to help our homeless families during this time?
Thanks, Joseph. So there's a couple of different things. One is, as you all know, a lot of our homeless population lives in a shelter, congregate shelters. There's no social distancing in those shelters. So we are now already moving people, especially the most vulnerable, who are older or who have health difficulties. We're moving them out into hotel rooms. We're going to be renting a couple of hotels. And those hotels will also, not only to help distance at the congregate shelters, but also there are two categories of people, excuse me, who are homeless, who we may have to help as well. We will have to help. And those are two groups of people who might need to be quarantined. So for example, let's say you're homeless and you have a positive, and you have taken a test for COVID-19, but you don't know the results. Well, during the period while you're waiting for results, you need to be quarantined. That period is getting shorter and shorter as we're getting better tests, but that quarantine will also have to take place in a hotel because those folks have no place to live. Also, for folks who test positive for COVID-19 but don't need to be hospitalized, maybe they have minor symptoms, they will also need a hotel room. And so the city, as working with the county and other agencies, a lot of the nonprofits, we're going to be renting these hotel rooms. We already have started that now, and there'll be much more of that. And so that's one big thing. Another thing is feeding people. And there's a whole group. There's what's called the Emergency Operations Center, and that Emergency Operations Center is it's whenever we have a declaration of emergency, a state of emergency, that goes into effect. And that coordinates a lot of the work of city, county, and other agencies. So within the Emergency Operations Center, there's a group that's dedicated to working on homelessness. It's bringing together a lot of the folks to do it now. And then there's a group of people who are dedicated to working on food security, especially for our seniors living in public housing and other low-income housing. So a lot of thinking around those issues, a lot of work around those issues, and I feel like great people are being involved in it, but it's going to be hard. It's going to be very expensive. It's going to be very hard. That's really super important. So thank you all for having me. I appreciate you. Appreciate all that you do. It's hard, I know. Isn't it hard? Being at home and outside your place of work can be very difficult. And you all are all people, if you're at ReCity and you're already people doing amazing and difficult work, and now some difficulty has been piled onto that. So
Yes.
I just want to say how much I feel for you and think about you, and please stay safe and help keep our community safe. I really think we all need to remember that if each of us can act, so all of us are safe, and that's what I hope I'll do together. So I appreciate you.
Thank you, Mayor Schewel.
Thank you.
Thank you.
Thank you very much. I'm gonna stop.
Thank
Well.
you.
Hang in there, you guys.
We will.
You
You
too.
too. Be safe.
All right, thank you.